And on that, here is the New South Wales Premier Gladys Berejiklian live in Sydney.
The number of cases acquired through community transmission is increasing, and it's really important at this stage of the virus for us to maintain that level of control and containing it as much as possible. We want to see fewer people have to go to hospital. We want to see fewer people die. But we know, unfortunately, as has happened around the world, the cases will continue to increase, and the more we can slow it down, the better it is for all of us and the more lives that we will save. I also want to, in particular, thank our frontline workers, whether it's our health workers, our teachers, our police, for really stepping up and keeping things going while we're going through these changes. And I also, in particular, want to emphasise to young people who've heeded the warnings. But today, as Dr Chant will say, we have had localised breakouts in areas like Waverley and Bondi, and as a result, Dr Chant will instruct all the medical professionals in that area to increase the level of testing, to increase the number of people tested in that community, to really reduce the community-to-community transmission. We know New South Wales has taken every strict measure we can to date to really control the spread. It's too early. I've read some speculation today about us bending the curve and what have you, but it's way too early to make that assessment. Whilst the number of cases have stabilised, there's a number of reasons for that. And what is of concern to all of us is that unknown, that level of community-to-community transmission that you might not pick up if people don't have the symptoms. And that's the real threat. People walking around without symptoms, not realising they have this disease. And that's why it's really important for everybody to assume they have it and to act like they have it. But I'm also very confident that we will get through this. Yes, it's been really hard to adjust. And for some people, the stress has been enormous. But please know that whether it's through federal government initiatives or through initiatives the state government is doing, that we are here to support you during this time. All of us are working together. All of us are coming together to support one another during this time. And if you have any questions or any concerns, please feel free to contact the 24-hour hotline we have in New South Wales, 13 77 88. We can provide information through Service New South Wales on any of the announcements that have been made which you might be eligible for, any issues you might want information on regarding the virus, or be referred to the relevant authority that can help you. Please know we are just a phone call away, and of course if you have access online, newsouthwales.gov.au is the address. But I want to thank everybody for stepping up. I want to please say to everybody, remain vigilant. Do not look at the case numbers on a daily basis. That's not the number to look at. What we need to consider is the community transmission that we might not even know about. That's the threat, the unknown threat of the community-to-community transmission we might not know about. And I want to in particular also thank New South Wales Police Commissioner Fuller for the wonderful work he and his officers have done in making sure we protect the community as much as possible. They don't want to have to issue on-the-spot fines to people. They don't want to have to issue fines to businesses or to people who aren't doing the right thing. But if they need to, they will. Because when lives are at stake, all of us have to accept that the world is different, and it will be different until this threat is gone. So thank you for everybody for stepping up, for agreeing to be part of us getting through this together. And please stick to the rules. This is serious. We're at a serious stage of the virus. And I want to thank the health authorities also, Dr Chan and her people, who've ensured not only through the testing regime we have in New South Wales, that knowledge, that information we have is really allowing us to contain the spread. I'm proud of the fact that we have done a lot of testing, and that has helped us identify where the threats are and to clamp down on them as much as possible. Dr Chan?
Thank you, Premier. So today we have 2,032 cases of confirmed COVID infection, and this represents 114 new cases. As the Premier indicated, that's pleasing to see a decline, but we need to remain cautious. We have seen a decline in testing numbers, and hence today I'm really urging that we increase the testing, particularly in areas where there's community transmission or around clusters. And that's to ensure ourselves that we have identified as many cases as possible of community in the community. It's important to know that case detection, us finding those cases early and then quarantining, isolating cases and quarantining, that's putting them in home isolation, the cases around that confirmed case, are important strategies for preventing onward transmission in the community. And this important public health measure complements the social distancing strategies that the government have put in place. But the contact tracing, by identifying these cases early in the community and identifying contacts of cases, is an important public health measure that we will need to continue with throughout this pandemic as the community spread occurs. In addition, I can report that there's 8 deaths in New South Wales, and there's currently 164 cases being treated in New South Wales, including 35 cases in our intensive care units, and of those 35, 16 require ventilators. Thank you.
Thanks, Premier. Thanks, Dr. Chan. As you know, the police operation continues, and last night we saw the New South Wales Health Act give police additional powers around restricting the movement of people sensibly, particularly in public places. Now we know that any more than 2 people out, you will get a fine. What does that mean? It means that if you need to exercise, we get it. Go for a walk sensibly on your own. You can still meet a personal trainer if you have to. The reality is, if you need to go to the shops to get some food, absolutely acceptable. If you need to go to the chemist or see your GP, all of these things are absolutely acceptable. But the reality is the messaging the Premier, the Chief Medical Officer, that have been giving over the last weeks and months has not been getting through to some people. And what does that mean? It means that the virus continues to spread, puts people's lives at risk, puts the health system under pressure. So as of today, police will continue to be out there working with the community, but we will be engaging in terms of people who are acting outside of what the health warnings are. There's still $1,000 fines, $5,000 fine for businesses, and for those that continue to flout the laws, that we can put you before the court for up to 6 months in jail. Again, we've written 13 tickets since these health orders came into place. I hope we don't have to write any more, but I fear that there will be individuals that won't get the message, so we will be out there. Business continues for us. 17,000 police are still out there. The 5 police that have contracted the virus all contracted that from overseas travel. Right? That in itself, you must understand why we have travel restrictions in place. Since the airport restrictions came in place Saturday at midnight, 2,096 people have returned into New South Wales, Australians, and have been processed through Proper Health, Border Force, Australian Federal Police and assistance from ADF into hotels in the Sydney metropolitan area. Around 80 of those have presented with symptoms and are being treated and or isolated from the rest of the group. We anticipate around 600 people will return today on around 12 planes. It's down on about 50% on what the expected load will be. But for the people who are overseas, and there's still many thousand Australians overseas, this operation will continue. Don't think you can see this out and next week the restrictions will be lifted. The operation will continue. Self-isolation still exists for those people before Saturday who have flown in from overseas or come in from a passenger cruise ship, 14 days at home. We've done thousands of checks on people to ensure they are complying, and those checks will continue. Now, the business of policing continues. We still respond to crime. Yesterday, we conducted a search warrant and arrested 5 people for having 200 kilos of cocaine. So the world is going on. Unfortunately, organised crime's going on, but so is the activities of the New South Wales Police Force. So listen to the health warnings. Police will be out there to enforce the health legislation, but we want to work with the community. Thank you.
So our local public health units have communicated to doctors in that area, and we will be communicating as well through the Royal Australian College of General Practice around various hotspots or areas where investigating clusters that are under investigation. So there'll be a mix of strategies. We're also working with St Vincent's Hospital to establish a pop-up site in Bondi, and we're aware that also the Primary Health Network is introducing some increased testing in that area. So we will tailor the strategy of increased testing to the circumstances. So, for instance, in some settings we may introduce a pop-up. In others we may work with existing GPs if there is good access through those general practitioners and support them in increasing access to testing. So we'll take a very tailored approach. We're also urging that there is high rates of testing in particularly rural, remote areas and Aboriginal communities because we want early warning of any introduction of COVID-19 into those communities. So our testing strategy is a comprehensive one where we really want to work in partnership with existing Aboriginal medical controlled organisations, GPs, our hospital system in order to increase access to testing in targeted ways. I would like to say that our testing resources are finite, so we are urging people and our health practitioners to be prudent in their testing.
OK, we will leave that there. So the takeout of that is that numbers definitely seem to have stabilised. Total number, 2032 cases in New South Wales. That's 114 new cases. But we shouldn't be lured into a false sense of security there because the number of testing has dropped. So we'll see how that continues. We do hope that that continues to stabilise, though. Meanwhile, more than 60,000 businesses have rushed to register for the government